Good afternoon. Good afternoon, everyone. Good afternoon. Whew. I'm coming from you from just a little bit outside today. It's a little bit chilly out here, but thought the sunlight would be refreshing. Good afternoon, everyone. Happy New Year. Happy New Year. As you join me today, please just wave and type your name into the. Hey, cuz Cheryl, thank you so much for being here. I appreciate you. Happy New Year. How's everything? Hey, Sands. Happy New Year. Happy first Sunday to you both. Thank you both for being here so far. Okay, okay. I hope you guys are doing well. Thank you for typing into the chat. Hey, Number. Hey, Lee. Thank you so much for being here. I appreciate y'all. I'm coming to y'all just sitting outside for a little bit, trying to get some fresh air. We've had so much rain and cold weather, so I figured I'd just, try to maintain a little bit of more time with nature. And okay, so we are going to get started shortly. Today, I've had several questions in the last few weeks about STDs. And so I figured we would talk today about STDs. Three things I want you guys to know about how to prevent them. STD stands for sexually transmitted diseases. And so I'm glad that you guys are here. We can, talk openly and honestly about different STDs and things to do to prevent them. And I want you guys to feel free to ask me any questions as they come up. And we'll make sure we get to cover as much as possible. Okay. So as you come in, please send me a wave or type in the chat. Hey, Cheryl, thank you so much for being here. Happy New Year. I know that's right, cuz glad to be in the land of the living. Amen. Hey, Teresa, Happy New Year. Thank you for being here. Hey, Holly, thank you for being here. I appreciate you. Happy New Year. Hey, Renee, sis. Okay, you're in the A. Okay, well, maybe we can try to catch up later on this evening. Okay, I don't have to work tonight. I was working all day yesterday, though. So, thank you guys for being on with me today. We're going to spend some time talking about STDs, three things I want you guys to know. Okay, so let's go ahead and get started. Let me go ahead and introduce myself officially. Welcome, welcome. I am Dr. Madeline, your board certified OBGYN, international speaker, and published author. I help busy women access accurate GYN information and birth control that they need so that they can have the most freedom and control over their lives that they need to be able to do whatever it is they need to do in their lives, okay? And when I say busy women, I mean women who work outside of the home as well as women who work inside the home. And so thank you for being here. To follow me on other platforms, I'm on Facebook, Twitter, and Instagram at Dr. Madeline MD. That's DrMadeline MD. Okay. So thank you for all of you for being here. So let's go ahead and get started. How to prevent STDs, three things to know. And this is always a great topic to start off the year with because, when there's a new year, there are new things that go on. Some people have new relationships, new booze, new partners. And sometimes this is a timely conversation. New side pieces. I have patients who come in who have, you know, maybe a permanent thing and an extra thing. This is not about judgment. This is just making sure that people have the information they need. So, when it comes to STDs, this is one of the things that's really important to talk about because I don't know if you guys know, but a lot of times, at least 50% of the time, people can have STDs and not have any symptoms at all. Okay, so that's important for you guys to know. So when it comes to talking with people and answering questions about sexually transmitted infections, that's sometimes where the conversation will start. People will say, okay, well, doc, I checked out my partner, male or female. I didn't see anything. Does that mean everything is okay? And actually, it doesn't always mean everything is okay. It could mean that someone could have something and not have any symptoms, or it could mean everything is okay and they don't have anything. So I always want you guys to be mindful of the different ways that you can think about sexually transmitted infections, different ways that you can protect yourselves, and different ways that you can get checked out if you have any questions or concerns. We've come a long way in terms of HIV, in terms of STD screening. 20, 30 years ago, it always had to be about going into physician's office. For women, it was about, having a pelvic exam, having a speculum placed in, sending a swab. And, in the last 10 plus years, we are able to do more urine based testing. So it doesn't always mean getting a speculum exam. And, men are very excited about that as well, because back in the day, it used to mean that they had to get a Q tip swab in their penis to check for any. Is my volume low? Let me turn it up. Someone is saying that I sound so low. Can you guys hear me better now? Okay. Let me know if you can hear me. I turned up the volume, okay? So yeah, those are some things to keep in mind as we talk about STDs. We've come a long way in terms of screening, and there are different things that we can do. So, what are the three things I want you guys to know? I'm going to tell you the three things, and then we're going to go over each category. One, the best way to prevent STDs is to, okay, great. Arnett says, yes, all good. Great, Lee, thank you. One thing to do is to use latex condoms every time you have sex. When I say sex, I'm talking about vaginal sex, anal sex, oral sex. Um, we don't have condoms for some types of oral sex, but you can use dental dams also as latex. Uh, Different types of condoms don't protect against STDs, including natural condoms that are like lambskin and some of the other types, but a latex condom will always protect you. If you are someone who has a latex allergy, that's definitely something to talk about with your provider to see what other options might be available for you. When I talk about uh, the different types of sex, and that's important for people to know too, because sometimes I'll have patients who will assume that if they're having oral sex, they can't be exposed to or acquire a sexually transmitted infection. And that's actually not true. Yes, the most common way you can get an STD is by having penile vaginal sex or penile anal sex, but you can also have STDs that can be present in your throat when there is oral sex that happens, whether it's cunnilingus or fellatio. And so that's something to be mindful of as well. A lot of times when you go see your provider, the way they will screen for STDs might be just to check your urine or check your genital region for STDs. But the more advanced clinical practices or places where they do a lot of screening for STDs, they will check all your different orifices to make sure that you're okay. So they might do a swab of your throat and your mouth. They might do if you're a woman, they'll do a vaginal swab, and they might do a rectal or anal swab as well. If in your sexual history you share with your provider that you have sex in a variety of ways. Again, this is not about judgment or anything. This is just about making sure people have all the information that they need so that they could be as healthy as possible. Okay? So that's the first thing I want you guys to know. The best way to prevent STDs is to use latex condoms every time you have sex. For those who have latex allergies, there are some polyurethane condoms on the market that can also help protect you. But again, that has to be evaluated on a case by case basis. And then sometimes people with latex allergies can be checked to see if uh, what type of allergy they have. Is it a strong allergy and they absolutely can't use any latex, or is it something where it's minor and the recommendation might still be to try a certain type of latex? Okay, so that's the first thing I want you guys to know. The second thing I want you guys to know in terms of STDs is that, again, many of them can occur without symptoms. So, a lot of times when we are talking about STDs and thinking about some of the most common ways that they might present themselves, you guys might be familiar with some of the more common ways. So, you can have a discharge. That's one of the ways it might present itself. You can have like a little bit of vaginal spotting that's different from your cycle, and it feels different for you. You can have a vaginal discharge that might have an odor or a different color. If you have a vaginal discharge that is normally like clear, that might be most consistent with your normal menstrual cycle, because when you get through the phase of your menstrual cycle, when you are producing the most estrogen, you have a thin, clear vaginal discharge that is within normal range. Okay, that's not unusual at all. But if you have a vaginal discharge that's yellowish or green, or or maybe it causes some itching. Those are different things definitely to get checked out or to call your provider about. Do a telehealth visit if you're concerned about COVID, and just check in and see, you know, um, describe all your different symptoms, describe what you're seeing, and then a lot of times, depending on what's going on and depending on our index of suspicion, we can prescribe something directly to your pharmacy, so you may not even have to come in. And so that's something to know in terms of how to prevent STDs. If different STDs can occur without symptoms, um, if you see any symptoms, that's definitely something to reach out to your provider about. And certainly, if you see symptoms in yourself or in your partner, make sure you get it checked out before you engage in sexual activity, even with a condom, because you just want to be as sure as possible about what might be present, and you want to make sure that you either don't acquire something unknowingly or expose someone to something unknowingly as well. One other caveat about latex condoms and prevention of STDs. So, yes, condoms can prevent against most STDs, and I want to name some of them for you. Because a lot of times I'll be talking with a young lady and she may not have ever heard about chlamydia, so I don't want to make any assumptions. So, condoms can help protect against chlamydia, gonorrhea, syphilis, trichomonas, HIV. The one of the ones that condoms may not be as protective against is herpes, and that's because herpes can live not just within the vagina or the shaft of the penis, which are the two areas that are going to be most involved in sex, but herpes can live in the skin tissue that's surrounding your genital area. And so even if you have on a condom, male or female condom, you can't guarantee 100% protection because all of those areas aren't covered. Okay? And so I just wanted to clarify that about when you use a condom and which STDs they protect against and which ones, like herpes, you have to be more careful about. So, those are the first two things. Use a latex condom every time you have sex. Many symptoms can occur without symptoms, and we talked about what symptoms to kind of look for. This is particularly true when you talk about chlamydia and gonorrhea. A lot of times people think that someone will be quote unquote hot or burning or have a very clear, thick discharge or something if they have chlamydia or gonorrhea. Absolutely not true. 50% of the time, people have no symptoms at all with chlamydia or gonorrhea. Okay? And so, what's the third thing? And this is very important because sometimes people get very nervous and scared if they do have an STD. Most STDs can be cured. Okay, that's very important for you guys to know. Most STDs can be cured. So, when you are able to get checked out and identify something early, you can most times, if you depending on what you have, you can get pills by mouth or a shot of antibiotics that can cure you. The ones that can be cured are chlamydia, gonorrhea, trichomonas, syphilis. The ones that will be with you even though they can be treated include herpes and HIV. Okay, so that's important to know in terms of what your different options are. Now, sometimes people will come in and say, you know, doc, or they'll call and they'll say, I haven't been checked out yet, but my partner said that they tested positive for gonorrhea, or my partner said that they tested positive for chlamydia. So I want you guys to know that in terms of public health measures, you don't actually have to be tested if your partner is known to be positive for a certain STD. I can just, if a patient calls me and says that, and they have strong proof or strong indication that their partner tested positive for something, I can, based on that information, just call them in a prescription because the presumption from a public health perspective is that even if my patient comes in and tests negative, she has still been exposed. Okay, and so by treating her, even without testing her, I'm just helping make sure that she can achieve a cure, even if she doesn't end up testing positive. And there are times when tests can be falsely positive or falsely negative, and so it's very rare, depending on which test you use, especially if you're using a molecular test. But it's just something also to keep in mind. So, again, the STDs that can be cured: chlamydia, gonorrhea, syphilis, trichomonas. You take the medicine. Also, very important because sometimes I'll have patients who will come in and they might have more than one test that is positive for chlamydia or gonorrhea. Maybe they get tested a month apart or 2 months apart, and they're like, "Hey, doc, what's going on?" So it's very important when you get tested, you and your partner or partners, again, because it's not about judgment. If you have one partner, that one partner has to get treated as well. If you have three, four, five partners, ideally, all of you guys should be treated, because as the sexual activity continues, whether it's one partnership or whether it's one partner having more than one partner, the way that you help make sure you don't get that STD back again is by is making sure everyone in that sexual partnership or sexual network is treated. Again, um, this again, it's not about judgment. It's about just making sure people have as much information as possible, and that everyone can get the treatment that they need, so that if they do have an STD or they were exposed to an STD, they're able to feel confident that they are getting a cure. Okay, and that's important because especially for women, and I don't know if you ladies know this, but um, we really want to get treated for STDs, or make sure women get treated for STDs if they're present, because STDs can have long-term negative effects on a woman's body. And so what does that mean? So I didn't bring my little a diagram this time, but if you think about, let me see if I can sketch it out for you guys real quick. We noted there's the uterus, and okay, so I know my little sketch, not as fancy as if I had an actual drawing, but imagine that, so when someone has an STD, it comes up through the vagina, okay, and it can come up into the intrauterine cavity. So here's where it gets complicated. If it comes up into the intrauterine cavity and it goes out into the fallopian tubes, it can scar those fallopian tubes. What happens if your fallopian tubes get scarred? That's when people can have low abdominal pain. That's when they can have something called pelvic inflammatory disease. If those tubes are scarred permanently, sometimes women can have fertility challenges due to those types of things. And so, again, it's one of the reasons why um, it's really important to get treated for STDs. Now, one of the other things I didn't mention that's important to know, because again, I started out by saying that a lot of times these STDs can be without symptoms. So, one of the things that's important to know is that if you are someone who goes in for your annual GYN exam, and if you are honest with your provider and they know that you are a sexually active woman, married or unmarried, it doesn't matter. If you are having sex with anyone, it's a routine part of what may be offered to you as part of your exam. And you can also ask for it. A lot of times we'll have providers, I know I did in my younger days, I had providers who would make assumptions about what I was or wasn't doing. And so maybe they wouldn't have offered me a test. But it's okay for you to say, hey, I have a new partner compared to when I was here last year, or maybe I have several partners and I would like to have an STD screen done, please. And so that is absolutely your right to ask for every year. With most insurance plans, as long as you're a sexually active woman in a certain age group, they will cover the cost of those STD screens, just to make sure that you have as much information as possible, and that you can make sure that you don't have something going on that doesn't have any symptoms that could be going. I apologize. I don't know what happened. Can y'all hear me okay? All right, y'all. Sorry about that. I don't know what happened, but we got disconnected. I was on my laptop, and so it's charged up and everything. So I don't know if Facebook disconnected me or if we had some other technical difficulty. But I do want to thank you guys for joining me today. I just wanted to come back on so that you guys knew that I didn't just kind of leave you guys hanging out there. But we had pretty much finished covering the three things that I wanted to talk about today. So I just want to do a quick recap. And again, I want to thank you and I want to apologize for those technical difficulties. Hey, cuz Pam, thank you so much for being here. So this is for those of you who just came on. Again, my apologies. Hey, Cheryl, thank you for coming back. I apologize for the technical difficulties. You know, I laugh sometimes because Facebook randomly cut me off, and I'm not sure if they were censoring my content because we're talking about STDs or if something else happened. But my laptop is fully charged, so now I'm just back talking to y'all on my my cell phone because I didn't want you guys to think that I just kind of left y'all out there. So if you're just coming in, for the last 25 minutes or so, we were talking about STDs, how to prevent them, and there were just 3 things I wanted you guys to know. So I'm just going to recap those things briefly, and then I'm happy to take any questions if you guys have any. But for the full session, please watch the video directly underneath this on my Dr. Madeline MD page. Okay. So the 3 things we talked about: how to prevent STDs. 1, use latex condoms every time you have sex. And we're talking about penile vaginal sex, penile anal sex, and oral sex. Okay. Latex condoms are dental dams. That's the best way to prevent most STDs. In the previous video, I also talked about which STDs may not be 100% protected by condoms, and those include what are protected are chlamydia, gonorrhea, syphilis, trichomonas, and HIV. And what you may not have 100% protection against is herpes, because herpes can exist on the genital areas right outside of your penis or your vaginal area or your anal rectal area, and so condoms are not 100% effective. Hey, Madeline, thanks for joining, son. Thank you guys who are here. I see you guys typing into the chat, and I appreciate that. So that was the first thing we talked about, is that using condoms, latex condoms, every time you have sex can be preventive against sexually transmitted diseases. The second thing we talked about is that many STDs can occur without symptoms. When you look at the different data from CDC, at least half the time when an STD is documented as being positive in a lab, the person can deny having any symptoms at all. Some of the most common symptoms might be a vaginal discharge that's different in color. If it's green, yellow, brown, or anything like that, that's not a normal vaginal discharge. A normal vaginal discharge tends to be more clear. Sometimes it can be white, and that's related to the hormones that are normally in our system as we go through our monthly process. If you have like different burning in an area, that's also something to get checked out. But again, keep in mind that a lot of STDs can occur without any symptoms. And the third thing I wanted you guys to know, because I think it's important, is that most STDs can be cured if they're documented as present. If you know that they're there, you can take either pills or get a shot and cure most STDs, and that includes chlamydia, gonorrhea, syphilis, trichomonas. The ones that you can treat and reduce symptoms but not cure all the way include herpes and HIV. So right now, those are examples of viral STDs that can be with someone for a lifetime, even though we have medicines that can decrease the number of symptoms that you have from them. Okay, so I gave more detail in the previous video. So again, I apologize for the technical difficulties. Thank you guys who signed back on, or if you were just signing on just now, please check out the video right before this for the full content in terms of what we talked about in terms of preventing STDs, or even being aware of STDs, and just different things for you to keep in mind as we start this new year. And if you have new relationships, new booze, new partners, these are just things I want you to be mindful of so that you can be as protected as possible. So thank you again for joining me today. Oh, we have a question. If you do have a question, please type it into the screen. Just curious, could they do a vaccine for STDs? I know there's one for HPV, but it's geared more toward teens or young adults. That's a great question. So it's not something that they've looked at, except, they've been working for a long time on a vaccine for HIV, but that's because when it was first recognized in the early 1980s, it really just carried such a high death toll associated with it. And so the idea was, let's try to figure out how we can vaccinate people against this mostly sexually transmitted, very fatal infection. And over the course of time, HIV has become less fatal, but they still haven't been able to successfully make a vaccine. HPV, also, just to give you guys some new information, as of last year, the HPV vaccine was approved for use up to age 45 years of age. And so you're right, Michelle. Initially, when it was FDA approved, they approved it for like as early as age 9 up to age 26. But as the years have gone on and they've gotten more and more data, we now know that it can be effective for women up to age 45. So even if someone has an abnormal pap test and let's say, a couple of HPV strains have shown to be positive, that woman, if she's 45 or under, may still benefit from an HPV vaccine to cover some other types of HPV and prevent her from having cervical cancer or developing cervical cancer. But yeah, they could probably try to work on some vaccines for some of these other STDs, but they have not yet made that a priority. I'll say it like that. So of the different things that scientists are working on, that hasn't been one that they've worked on yet in terms of a vaccine for STDs, except for the one that you're right about that we have for HPV, and the ones that they've been working on unsuccessfully so far for HIV. And we're still a long ways away from one for HIV. Okay. Are there any other questions, guys, while we are here about STDs, how to prevent them, what some of the more common ones are, how to recognize them? Again, many of them are not recognized, in terms of symptoms. But I just want to encourage you, ladies, when you go for your annual GYN exam, talk with your provider to make sure you can get any screening that you think is important for you to have. If you have a new boo, a new partner, or a new side piece, those are all reasons to say to your OBGYN or your nurse practitioner or whoever you see for your care, to say, hey, I may have a new exposure. Could you just check me? And you just start at baseline to make sure you have the information that you need so that you can have the most protected and safe and worry-free sex that you would like to have. Okay, so I'm going to wrap up for today. I thank you guys so much for being here. I appreciate y'all. Let me just check again to see if I have any new questions. Oh, hey, Madeline. Yes, a new side piece. Yes, my patients give me all the different lingo, and so I flow with them to make sure they feel comfortable, and so that they make sure that I'm not judging whatever it is they need to do, or whatever it is they feel they are doing sexually. So yes, we embrace all the different terms for partnerships. Okay, so again. I jumped back on my phone because I lost my connection on my laptop. So I encourage you guys, I want to thank you guys again for being here today. I encourage you to take a look at the previous video, which cut off after about 19 to 20 minutes or so. And I'll go ahead and sign out for today. So again, my name is Dr. Madeline, your board certified OBGYN, international speaker, and published author. I help busy women, whether they work outside of the home or inside of the home, access accurate GYN information and birth control access so that they can have the most freedom and control over their lives as they need to have to get done the things they need to get done. Please, by all means, follow me on Facebook, Instagram, and Twitter at Dr. Madeline MD. That's DrMadeLinemD. And I thank you so much for being here. Oh, and Michelle says this should go for men too. Absolutely, Michelle, but that's a whole different conversation. We can do a whole Sunday session on what should go on in terms of men being screened for STDs. And so far, we don't have the same amount of, recommendations and guidelines for men, I think it's probably because they don't go see the provider as often and as regularly as women do. But absolutely, it's something that has been discussed more so amongst younger groups of men. But you know, when men have different sexual partners, one, more than one, you know, it's absolutely recommended that they should get checked out too, because like I said earlier, a lot of times they don't present with symptoms, just like women. About half the time they can have no symptoms at all. Teresa said, thank you for the info. Thank you, Teresa. Thank you for joining. Hey, Dr. Kelly, thank you for being here. I appreciate you. Pam says, thanks so much for this helpful info. Yes, freedom to live independent lives. Absolutely. Whatever your sexual desires are, whoever you're partnered with or side piecing with, you know, have the information that you need to be as safe and worry-free as possible. That's my wish for all of you. Okay? So I'm going to sign off. Again, I want to thank you guys. And again, the previous video right before this, before I got cut off, has more information. So I encourage you to take a look at that as well. And I will check on you guys and we'll chat again next Sunday. So again, I'm Dr. Madeline, your board certified OBGYN, international speaker and published author. And I help busy women access the accurate information and birth control care that they need to have the most freedom and control over their lives that they desire. So by all means, follow me on Twitter, Instagram, and Facebook at Dr. Madeline MD. Thank you so much, guys. I appreciate y'all. Love you. Mwah. Happy Sunday. Oh, Michelle says maybe for a future live session you can partner with an MD urologist to discuss symptoms of men or their questions. That's a great idea, because I actually have a colleague who's a black female urologist who I'm thinking about setting up a joint conversation with for Facebook Live. So thank you for that recommendation. I'll reach out to that colleague and see if I can get that scheduled. And I think that would be a great discussion, because she deals both with female urological issues and male urology as well. So thanks so much for the recommendation, and I hope y'all have a wonderful the rest of your Sunday, okay? All right. Love you guys. Bye-bye.